Hello everyone, this is Krista Lacastesantos here to present two cases of diseases, starting with an organ system disease with secondary mental health disease. So this specific case is titled Living with Lupus. So the overview of this case is a 20-year-old unmarried woman presents with frequent hair fall, itching scalp, fever, and hallucinations. So her chief complaint would be physical problems, which is hair fall at this moment, and psychological problems, specifically suspiciousness, hearing of voices, and crying episodes. So her social history is she was previously diagnosed 5 years ago of systemic lupus erythematosus with predominant skin manifestations, or basically lupus. So lupus is a condition where your body's immune system attacks your own tissues and cells. So 5 years ago, hers attacked her own skin cells. But when she was treated by a dermatologist, she discontinued medication 2 years after because she was treated for the time being. So her current physical examination is that she's pale and has dark pigmentation all over the body, and her hair is sparse and thin, which is a mild version of skin-based lupus, and some more serious psychological effects like irritability, restlessness, third person auditory hallucination, or basically she's hearing things that she doesn't really she isn't really supposed to hear, and delusion of persecution, or she believes she is being attacked or insulted, and blunt affect but conscious and oriented. So basically blunt affect is the bluntness of reactions to things, bluntness of emotions. So her diagnosis would be neuropsychiatric systemic lupus erythematosus, or specifically organic delusional or schizophrenia-like disorder secondary to systemic lupus erythematosus. So basically, this is lupus, but with symptoms of schizophrenia. So this time, as seen with the irritability, restlessness, suspiciousness, delusions, and hallucinations, this time her immune system attacked parts of her brain, spinal cord, or nerves, impairing her ability to see things as they are. So her treatment was 10 milligrams per day of olanzapine per tablet. Olanzapine is a treatment for schizophrenia. So 2 weeks later, a significant improvement was observed, and soon she was discharged. The second case would be a common mental health issue during the pandemic. So let's see. This specific case is titled A Tired Mom. So the overview of this case is a 27-year-old female veteran presents with complaints of fatigue and headaches, possibly major depressive disorder. So her chief complaint are headaches and fatigue, as already said. Her headaches are dull and generalized, meaning there's not a specific place. There's not a specific kind of pain. They're just headaches. And she always feels tired and can't sleep well. She has lack of interest, and she's unable to concentrate, and she has frequent crying spells, and she has experienced a 10-pound weight loss. So her social history would be that she has no significant past medical or psychiatric history, no regular medications, no intake of alcohol or drugs, and she is married and has 2 children. So basically, she has been a very healthy individual until now. So her physical examination revealed that she has a cesarean scar from surgery 6 years ago. She is cooperative, alert, and oriented with no delusions or hallucinations, and she is goal-oriented and logical. Although she does have psychomotor slowing, which means that her speech and her movement is slowed, and she has feelings of sadness almost all the time. So she has shared that her husband is in Iraq for business, so she may have been feeling lonely, and she has thoughts full of worries with feelings of hopelessness and worthlessness, but she doesn't have any current suicidal ideation, or she doesn't think about suicide. So her diagnosis is major depressive disorder, which is characterized by sleep disturbance, loss of interest in activities, increased worries, fatigue, concentration problems, loss of appetite, psychomotor slowing, feelings of hopelessness and worthlessness. As you can see, majority of those she is experiencing. So her treatment would be cognitive behavioral therapy. So she is prescribed 1 session per week and 50 minutes per session, and some antidepressants, or specifically selective serotonin reuptake inhibitors or SSRI. So SSRIs raise the levels of serotonin. So serotonin is a chemical that carries signals through the brain and is said to have good influence on mood, emotions, and sleep. So her SSRI, the prescribed SSRI for her is specifically Lexapro. So that's all for this case presentation. Thank you for watching and listening, and thank you very much for taking your time. Bye.